My name is Chia-Chun Liu. Now I'm a thoracic surgeon, of course you know. Since I was a child, my father hoped me become a doctor. At that time, I don't know why. But later on, I realized that as a doctor, you don't not only have the privilege to help the patient, but also you can do something innovative and reduce sufferings. So later on, I become more and more interested in this career, and also just because I believe in my hands. Since I was very naughty in the childhood, so I made some things with my hands, some toys, you know. Yeah. So I believe in myself. So I choose surgery as my career. Now I'm very fortunate to born in this period. So as everybody knows that nowadays surgery become from open, big wound to minimally invasive. So lots of instrument technique and also the needs for cancer surgery. So gradually I become interested in this career and become what I am now. So this is my brief introduction. Yeah. I don't really have my own ambition on a particular job. Since my father asked me so, and I also interested in I'm interested in tiny little things like fish. When I was a boy, usually I want to catch the fish, observe those shrimp in the small river, and you know those things. And when I studied in my senior high school, junior high school, I also interested in biology. So that's why it's just like a nature things, it just happened. So no particular reasons. Of course, I have considered the others like art. But you know, at my childhood, my family, the economic condition is not that good. That enable me to go overseas to learn something about the artist. So that's why it just happened, and actually I was quite happy about this. Yeah. Yes. I think why I leave this my cell phone to patient because I worry about him. I really care about him. And not I give cell phone to every patient. Only when I was considering there's a risk, or there might be some worries, or to comfort them. Then I will give my cell phone to them. Just because of this, they always respond to me if they have some tiny little problem, or even they have worries, considerations, or they do have suffering. So in these particular reasons, I can detect the problems early as possible. That's why I give my cell phone to them. As for any kind of interesting things, I don't think so. It's just for my own consideration, and also for the patient and their families. This is also another, I think, it's a safety step for me to early detection that kind of possible complication. So I don't have to worry. Even if I was in overseas for a visit or travel, so I still can entire control the things. So that made me feel more comfortable. Yeah, that's just in case. So it's not for every patient, just for selected patient. I think it really works. Yeah, and Of course, there are some consideration because some surgeon will consider if they was bothered too much. So usually I will inform the patient and their families, try not to talk, have chat with me in the night. So they really cooperate well. Yeah.
So there really some passion contact you before, or?
Yes, they do have. And usually I will, just in case, if I'm really consider about something, I will let them know at what time precisely they can contact me or just give me a report. So let me know that they are really in well condition. Yeah.
In what kind of situation they might contact you? It's like when they feel something unwell or something.
For example, because usually I will give this kind of my cell phone to high-risk patient. For example, very old age or esophageal cancer, advanced cases after very extensive surgery, and also they might be still not in very 100% safety. I will give them some instructions, and that situation usually we don't have, but just in case they can contact me because we are in a very I myself in a cancer center hospital. It's only 200 beds, so the duty doctor in the night shift is not belonging to a specialist like I myself. So once they dial the phone number to the ER, the doctor there might not be totally aware of their situation. So it will be more easy if they can contact me in time and at a very precise condition. It will be much better if they contact with the emergency doctor and they have no idea about their condition, then transfer the patient to the ER, make something wrong, or then contact me just for help, or they will be delayed. So I think this save times and also more safe. So it's about quality control, discipline, and of course the outcome. So the patient came to us because they want to live, not because they want to become beauty. So our goal for this kind of surgery is to cure the patient whenever possible. So, however, the patient in the open chest surgery, that time, of course, they suffer a lot. So, for example, the big wound will induce complication as infection, bleeding. So, in my own opinions, any improvement in the surgical field should be devoted by our surgeon, including the wound outside. But for the trauma or surgery inside, it still needs to be remained in the same way. I think the minimally invasive, not just because it reduces the size of the wound, it also gives you a clear view of what you are doing inside the chest. So through the video sharing, you let the others know what you are doing. Are they adequate or compromised type of surgery? So you should, actually I think only the surgeon know what he is doing. Is it good or not? It's not just only confirmed by himself. You need to let the others know, not only on the report, for example, your survival, or just some talk, experience sharing, but also on academic journal, for example, JTD. And also you need to let the others know what you are doing. Are they really as good as you say? And also not inferior to open procedure. So that's, I think. And also you need to teach the young and let your assistant, for example, scrubbing nurse. If they are really looking on the monitor, they will know exactly what the next step will be. They can prepare for you. And the anesthesiologist know what you are doing. For example, if you compress on the hilum, they will induce blood pressure drop. So if you are, when the open age at the time, is people all around, you have the anesthesiologist have no way to observe what we are doing. So the communication between team members become better in minimally invasive age. So that's why I think, yeah. If you are talking about our recommendation for the young surgeon, I think it's the most important thing is to do the right things, not compromise and never compromise the patient's safety because your own reasons. I think discipline is the first things. The discipline including what kind of patient you choose for minimally invasive, what things you are doing, are you meet all the standards inside, and are you truly take care of the patient no matter what time, even in the midnight. So I think these are all very important, and my suggestion for young surgeons.